morning, everybody. This is Dr. Debasish Saha, Senior Consultant in Internal Medicine, Diabetes and Endocrinology, AMRI Hospital, Salt Lake, Kolkata. Today, I want to enlighten all of you regarding the disease process known as rabies. World Rabies Day, it is celebrated every year, on 28th of September, to mark the death anniversary of the French scientist Louis Pasteur. And the idea was to eradicate the disease process from the globe. The first concept of World Rabies Day was launched in 2008 by Global Alliance for Rabies, and after that every year it is being celebrated. And the disease process rabies is usually contracted by the person from a rabid animal. That rabid animal is usually mammal. Commonest is bats, then it may be even cats and dogs or other mammals also. Whenever there is any bite, it can be of three grades. Just the touching with the tongue of the rabid animal means licking. Then there is minor cut injury, bite injury. And the third one is stage 3 or grade 3, whatever you say, it is lacerated bite injury. According to the bites, the stage of the bites, the treatment is recommended. Whenever there is any contact like this, it goes through three phases. One is prodromal phase, which simulates any viral illness like even common flu or influenza, like headache, body ache, malaise, say rhinorrhea, like that, followed by one neurological phase and followed by paralytic phase. In the neurological phase, the patients, they start having confusion, they start showing agitation, and there may be convulsion, there may be hydrophobia, there may be aerophobia, and in the paralytic phase there may be total quadriparesis also. But the disease is preventable. The seriousness of the disease is to the extent that every year globally there is death of around 70,000 people. So if we can prevent a disease which is preventable, say for example, whenever there is a bite, you have to contact to the nearest medical center. The first job is to wash the wounds thoroughly with soap water and contact nearest medical service center, get immunized with the tetanus toxoid, and say stage 1, where there is your minor just leaking, no bite, there is only indication of your rabies immunoglobulin. That rabies vaccine is usually given in the dose of 0, 3, 7, 14 and 13 day, and usually grade 3 bites, these are the people who are given concurrent human rabies immunoglobulin administration. This human rabies immunoglobulin, the dose is usually 20 units per kg body weight, half of which is usually injected intramuscularly, and the another half should be injected subcutaneously in and around the wound. Of course, depending on the nature of the laceration, and proper antibiotic should be given. But whenever the patient is coming at the earliest possibility and the patient is given proper care like this, as I have said just now, the disease can be prevented. Such a fatal, lethal disease, it can be prevented altogether, because I said that through saliva and the bite, the disease travels through the nerves ultimately to the brain, and the patient develops these sort of neurological features and the paralytic features. So, my idea was to enlighten regarding the nature of the disease, which is totally preventable, and in the initial phase, appropriate care should be taken. And the goal is to eliminate the disease process. Even, as an Indian, I'm proud to say that our Indian goal is to eliminate it by 2030. That's all about World's Rabies Day celebration. Thank you.